So these are the toxic truths. This is basically our crash course in toxic metals. Like I said, please feel free to take copious notes so this makes sense to you, but be aware they're all around you, everywhere you go. And I will make that clear before the end of this presentation. The objectives of this particular course will be to define the toxic metals versus heavy metals, a question that I'm asked all the time on consult. Explore the cellular and systemic harm that these things do, identify the sources and exposure pathways, which I will also do. We'll discuss how to test these and how to detoxify these and the challenges. And we're going to present some interventions so that you could see how it works for clinical practice. Hopefully, this will give you all the tools that you need to be incorporating as of tomorrow morning without fail the use and understanding of toxic metals and how they're affecting your clients and patients. There is a huge difference between using the word toxic metal and heavy metal. I know everybody uses heavy metal in their conversation. It's even in the literature often, but it is incorrect. Toxic metals are elements that are harmful. Where we get the word heavy metals is from where their atomic weight is and where they're positioned on the periodic chart. That doesn't mean they're toxic. For a perfect example, you could make zinc toxic, but without zinc and its 400 chemical reactions per second, you would not be alive. And that goes for other regular or normal heavy metals in that category. There is also metals, by the way, that are not considered heavy, but are also still toxic. Aluminum is one of them. Even though it does not fit into the periodic charts equation, it is still considered a toxic metal. Metals with no biological benefit and high toxicity are the toxic metals. We'll go into each of these, so you don't need to memorize this, but just be aware there is zero need in human nutrition for toxic metals. How toxic are they to the body? That's what we need to explore first, so you realize why it's so important. They can inhibit pretty much all enzyme activity and for protein synthesis. They can do this pretty much across the board, and they incorporate into so many different reservoirs, which we'll show you as many as we can today, that pretty much every cellular group across the table will be affected, and eventually the cascade of problems will lead to immune dysfunction. Now, if you have any patients that have immune dysfunction, for example, as someone gets older, the two systems that typically begin to decline are both the immunologic system as well as the neurologic system. And that's right, for those that are listening, toxic metals will disrupt both of those areas significantly and will accelerate your problem as far as having patients get sicker further, and you're addressing them will be tougher without getting rid of these. Toxic metals do create oxidative stress. I think most are aware that one of the reasons we have so much problems is we create oxidative stress. Most reactive oxygen species, just for a general overview, are actually made by the mitochondria. So if you have, and for those that recall, this is the powerhouses of the cell. Mitochondria basically are anywhere from several hundreds to thousands per cell, with the exception of the red blood cell, which does not have mitochondria, by the way. So all the other cells and organs in the body require that mitochondria does produce our typical fuel, which is ATP. A triphosphate bond, as we know, is adenosine triphosphate. So these will be damaged if you have toxic metals that are being accumulated in these various tissues and also getting accumulated into the mitochondria associated with these tissues and cells. So there can be some interference with nutrient absorption as well. They disrupt the body's ability to absorb these different nutrients. So again, it may change your optimal, so to speak, type of program. You may need to give a lot more of a specific nutrient or less, depending upon the presence of these toxic metals, because they will interfere with the body's absorption of them. Therefore, you may need to use a lot more than typically that you're taught or been told by other instructors. Children and, of course, elderly very much more vulnerable. Why? Think about it. A child has a underdeveloped liver, elderly have all the problems and all the things that they've been exposed to over the course of whatever 65, 75, or 85 years that would actually cause more nutrient deficiencies to begin with, and therefore even create a higher need than anybody else. Just be aware of this if you could. One of the things we talked about was this immune dysregulation. Inflammation is the nidus pretty much for all diseases. It is for cancer, which I teach the metabolic course for to doctors and postdoc pharmacists. It also, the toxic metals cause inflammation everywhere. So when you're sometimes getting these tests back, for example, I'm asked often, hey, I got back this high sensitive C-reactive protein and I can't find the cause of this thing. One of the very first things that should come into your head is, whoa, do they have a toxic metal? One other tip that you may see as well, many of you do homocysteine as part of your panel, and you should. When homocysteine is high, we know that the body's capability of methylating or getting rid of these different toxins is poor. When it's very low, meaning less than 5, if you get a homocysteine back less than 5, 4.5, for example, it means the body is a hypermethylator. It's methylating like crazy. It's trying to get rid of something. And in most cases, you're going to find it's a toxic metal. So if you have several patients and haven't run a toxic metal evaluation on them, it would be appropriate to do. So let's talk about the cellular impact, because this is where everything occurs. When you're doing physiologic medicine, you're really looking to what's functionally happening to the patient as well as to the biochemical reaction of the patient. As I alluded to a little earlier, mitochondrial dysfunction and impaired ATP, that's a process of pretty much every single disease. Under normal circumstances, one molecule of glucose in any given cell will make 36 net molecules of adenosine or ATP. However, as we get older, we make less. If there's diabetes, you make less. So we're talking 36 at a biochemical structure that's optimal. So these impairments or these things as age and disease, including, by the way, cancer, which is a mitochondrial respiratory or mitochondrial failure disorder for not making ATP, the body then will completely destroy that cell, but the toxic metals hinder this function. They impact ATP. They reduce its particular production. And then, of course, fatigue and every other health issue will ensue. Hence, another reason why this is so important to identify. You will get DNA damage and mutations, which can lead, obviously, to a cancer itself. And you get a lot of oxidative stress. As I said earlier, it's the mitochondria that produces reactive oxygen species. You want some amount of it because that's what kills pathogens. You don't want too much. So if you have too much of these toxic metals in the body, the impact can significantly exacerbate oxidative stress, lead, cadmium, and many of the others that we'll talk about today. These oxidative stressors will, in the end, cause DNA damage, and I'll explain more how it does that as we go on. So one of the things that happens is there is a membrane that encases all of our cells. I don't know who you read. I used to say 100 to 200 trillion cells. Some the researchers now say there's 39 trillion. It's up for grabs. I don't know anyone sitting there counting how many cells the human actually has, but let's say it's a minimum of 39 trillion. Regardless, around every single one of our cells is a microscopic membrane, the cell membrane. Now, what's important about that cell membrane is that 50% of it is fat, and toxic metals will instigate this lipid peroxidation. They'll create that MDA, malondialdehyde, which suggests that the lipids or the fats are going rancid. You know what I'm talking about. Ever go into an elderly person's home and it smells like the person's old? That's hydroxynonenal 4. It is actually an oxidation of the fats that are in the cell membrane. Now, that occurs at varying levels, and I'll speak to it a little bit further in a moment. But these toxic metals can affect that cell membrane. It can affect the cell survival. It will cause lipid peroxidation and eventually create the most violent or the most strongest of these types of lipid degradators, and that is the OONO or peroxynitrate free radical. And that does create DNA adducts and DNA damage that we were talking about. So in severe cases, what will happen when the cell really gets hurt, the body will use one of its mechanisms of killing it. There are several of them, but the ones that will be used in the case of toxic metals are either apoptosis, meaning the cell will be killed, or actually necrosis, where there's an actual cell death that will kill that particular cell. So again, toxic metals will trigger these abnormalities, these mechanisms, and it is a significant health risk. And the outcome, of course, is the danger to the patient. Don't know about this? How in the world will you treat it? That's why you need to be aware of this and cognizant it's available in every person. So what are some of the specific toxic metals? Where are they? What happens to these things? No matter how much of a toxic metal you have, I should say up front, any little bit. I know people, I don't have a lot of it. Sometimes they'll say, it doesn't matter. Any little bit of a toxic metal is toxic. In certain individuals, depending upon them, a little bit may be very toxic and others less, as we showed one example earlier of the younger individual and the older individual. That doesn't mean it's not the case mid-age or even teenage time. It depends on that individual. But let's take each one of them, for example, and talk about their impact. Lead's the first one. So lead is found, of course, in different things: contaminated water, soil, lead-based things are in homes. We found it in pretty much 32 lipsticks, red that is, that they've seen in the past. I want to mention as I go along the half-lives of these. It will be very important to something else that I'll show you later. Just start to jot this down either in your mind or on a piece of paper. Half-life in the general circulation I'm going to give you of lead. Lead is 1 to 2 days. It's then distributed through the liver and the kidneys, and with hours to days, it goes into its reservoir. And when it goes into the reservoirs, which is the bone, of course, etc., you're looking at a half-life, if there is such a thing, because it's a metal, and you can put metal in the ground and there is no half-life. So assuming they're considering a half-life, in this case, lead is 20 to 30 years. Basically, even if you get exposed to a tiny bit, even 100 and some years from now, the lead will still be there. And it depends on your own body's detoxification pathways, whether you can get rid of this toxic metal. Let's view another toxic metal, and let's talk about cadmium, lead, mercury, arsenic, and gadolinium are all considered what we call the vasotoxic metals. They irritate the living daylights out of the vascular tree. Trying to find out why someone has inflammation and can't put your finger on it? Did you check toxic metals is the question. Now, cadmium's half-life is only 1 to 3 days as well. That's all. And so it will go into its different areas as well. And it can cause a lot of issues, especially cadmium, as well as lead can cause kidney failure. You're getting patients, by the way, think about it, with renal dysfunction. Most of the time, the nephrologist, what will the nephrologist do? If they do biopsy, they'll say, oh, yeah, or if without a biopsy, we're going to watch your BUN and creatinine, but never looking for the root cause. Root cause medicine is everything. Again, if you know that there's cadmium and they have kidney problems, you should be removing it as part of their healthcare providing situation. Okay, let's talk about mercury, which also is pretty much ubiquitous as well. Its half-life is only 1 to 3 days. Inorganic mercury is cleared quickly from the kidneys, and organic mercury from fish also goes into the system. Again, you're probably aware it can come from many sources, and it has a lot of health risks. One which I want to point out is neurologic problems. Remember the hatters, they were called mad hatters because they used mercury to water seal the hats. They went mad as a hatter because mercury can cause problems. Oh, wait. My patient's never exposed to tons of it. Doesn't matter. Even little quantities, which I will try to emphasize as many times as I possibly can and will, cause destruction of the cells that where it attaches to. And neurologic is one of the main, and the vascular system, which is 64,000 miles, also takes a very large hit. Arsenic, pretty much everywhere. Arsenic is in the groundwater, as you can imagine. It's 3 to 6 hours. That's all is its half-life. If you, for example, had some rice or they found it in applesauce, for example, in apples, you might be having acute exposure, a little bit of that. Arsenic has been found to increase breast cancer risk years and years later by about 28%. They also found that even exposure to certain amounts, even minimal of arsenic up to 40 years later, increases the risk of bladder carcinoma. So most of it's from drinking water. Again, it can cause everything from cardiovascular disease, as it too is part of the vasotoxic ones that are irritating, as well as, of course, cancer, as we suggested. Aluminum, we did already mention aluminum. It is not a heavy metal, and hence the reason we use the word toxic metal. Aluminum is a toxic metal, and its half-life is only 1 to about 8 hours. Cookware, antiperspirants, for those people that are still using them with aluminum, is a huge mistake because, as you may or may not know, when the armpit and the groin are always giving liquid off, they're always should be wet. That's one of the ways you can always check to see if someone is hydrated, other than just looking at the tongue and the tenting of the skin, or in the patient, as you do in a hospital, you could check in the groin because water is always produced. And of course, it could possibly neurotoxic. Alzheimer's risk is increased, or at least cognitive decline is increased with aluminum. There's no question. And by the way, for those of you that like tea, please do not put in your tea lemon or lime. It is a harsh mistake in tea because it does come from the earth. It has a lot of aluminum since it's the second or third largest abundant mineral in the earth. Aluminum will be held tightly by the compounds in tea unless you use citric acid. And by putting, of course, a lemon or lime, which has citric acid, you will split that bond and you'll have free aluminum to go right through the blood-brain barrier. Hope I didn't mess up any of your thoughts of having a little bit of tea with lemon today. Cesium, another one everybody sees, half-life only 1 or 2 days. Most of it's non-radioactive. It goes into the soft tissues very rapidly, and eventually it goes on. Its biological half-life, they're not really sure, is 50 to 150 days, but it does come also from nuclear plants. So if one of your client's patients lives downstream to a nuclear plant, you may find this. And of course, it can get into food. I love green tea. I actually go take a gulp of it. I have some with me during the seminar. And one of the things I did before I buy the perfect matcha green tea, which is the ceremonial Japanese grade, I also do one other thing. I check, where did it come from? So I make sure my source is far away, over 848 kilometers from Fukushima, which had the meltdown, because it does get into the soil. Its half-life of these radioactive materials is so long, and then you do not want to get incorporated, especially into my green tea, because then it will negate all the good things that it's trying to do. And you see some of the effects that this can have. Let's go on to rubidium. I can promise you, when you see cesium elevated, you'll also find rubidium is simultaneously elevated. Its half-life is about 1 to 2 days. It also, like cesium, they mimic potassium. As a matter of fact, in people that have a lot of rubidium, potassium, make sure that you've checked their potassium. I really think checking the red blood cell potassium, since potassium, along with zinc and magnesium, are intracellular source of these metals, you'll get an idea that these patients aren't low, because they can end up with muscle fatigue, pains in the muscle, because they have a lot of this. Using reverse osmosis may eliminate this, but you got to remember, people go out to eat, they go out to drink, and believe me, the things in the restaurants are hardly filtered enough to remove the sources of cesium and, of course, rubidium. Titanium is pretty much also ubiquitous. And you first think, okay, what about the implants? People have their implants, dental, and of course, material in their legs, etc. The implants are one thing. The other thing that we often forget is the titanium dioxide, or the tiny nanoparticularized titanium that's often in cosmetics, especially cosmetics that want to take away oil from the skin, etc. So it does cause inflammation. It can cause lung toxicity. And it is in the food industry workers, we see it more as well. The half-life on titanium is 1 to 3 days. That's in the general circulation. Thorium is another metal that we test for often. It has a half-life of about 1 to 2 days. Its activities typically are in mining and typically through inhalation ingestion that we get it. And it does get deposited into bones and liver. The half-life is, so thorium and titanium, although you think not so much of them as the other ones like mercury, lead, cadmium, they are still quite virulent in their activity of inhibiting and causing cellular disarray and dysfunction. I don't need to remind you, the FDA is certainly aware of this. Gadolinium, no matter what the radiologist tries to tell you, it is a toxic metal. And this is where people get it. Gadolinium can cause something that's really problematic. Look at the third dot down. Potential effects include nephrogenic systemic fibrosis and retention in the brain. That's right. It is vasotoxic. It does detoxify and cause problems with your 64,000 miles of circulation. And it doesn't come out easy. As a matter of fact, gadolinium is the worst of them because the actual chelating agent, which is intravenous, is not readily available to the public. Things like EDTA, ethylene diamine tetracetic acid, take years to get it out. I'm going to give you another solution. As a matter of fact, I'll give you an easy solution now. I always send, and I'll talk more about this, any of my patients that go for an MRI with contrast, which is the gadolinium. If there's no gadolinium contrast, obviously you don't need to worry about it. But any of them that go, I always give them a bottle of what I call advanced zeolite. And I'll talk about this in a moment because it's that important. And I tell them after the procedure, take 4 the next day, and 4 the day after that. If I get it before it goes into its reservoir, and I told you, the half-life in the general circulation is only 1 to 2 hours. So this is not something you should wait for 5 days or 10 days or look at later on, because it will be there for the longest that you've ever seen. So don't feel bad about treating this right away. Let's talk about synergistic. Let me make this clear. I already said that 1 or 2 metals don't have to be very high in their accounts. That's not important. Even a little bit is very toxic, but it's not additive. You have lead, titanium, and gadolinium. It's not 1 + 1 = 3. This is geometrically increased. They become extremely more toxic. A good example is, for example, lead and mercury I put there together worsen oxidative stress. Let me give you one other example so I can underscore this. For example, if you take and you have cadmium in the system, I told you earlier that it can irritate the kidneys, but so can lead. But the combination of lead and cadmium is so much more irritating to the kidneys. Again, who's testing this if not you? And they share these pathways that overwhelm pretty much our detox systems. So you're never going to see, I'm telling you up front, if you do what I teach you coming up, you're never going to see just one toxic metal. It just doesn't exist because there are 3,000 chemicals and toxic metals in the air when you breathe in. There are so many toxic metals in the shampoos and the conditioners and the creams and, of course, the makeups that there's no way that people have just 1 or 2. Remember, the half-lives are not even really to be counted because the half-life of the metal is pretty much forever. Take a piece of metal, lead, put it on the ground, you can come back, you're great to the 80th power. Offspring will still come back and find it there. So It's very essential for you to be able to diagnose this and see what's there and treat it. And don't worry, I'm going to help you treat that today. So how do you get exposed? I think by now you've heard some of these, but just to reiterate them: air, water, soils contaminated. It comes from fish, as that's why if you don't want to get a lot of mercury, even though you still will get some, you should always eat wild caught fish and those that are sustainable, meaning the little ones can't get to the line. The older ones are thrown back, and just the ones in the middle, so to speak, middle age, that get taken. And of course, you want to use those fish that are non-predatory. The predatory fish are the highest in, of course, having these toxic metals, especially mercury. And of course, think about smoking, which of course contributes a lot of cadmium and lead, cosmetics and occupational risks. And depend where someone works, always ask about, what do you do? Where are you? And think toxic metals, toxic metals, toxic metals. And again, they're going to enter the body through dust and through thick contact. And the key is the bottom dot, which I did say before, I will say again: bioaccumulation leads up to gradual tissue buildup. You can say, someone will say, wait, I don't know how I got exposed to that. And the truth is, they may not, because it could have been from 20 years ago. But it's been added to as their life goes on and the older they get. So I want to talk about testing for toxic metals, and I want to make it very clear. And I want you to go to that right side of the little dots, the bottom one, and I want you to look at it and really take it in very carefully, because I hear about this all the time. There is a very big limitation, and if you don't do provocation, you won't get the right answer. Let me put this in a different English. If you do a spot urine, a urine that's not challenged, you're wasting your time and your patient's time for the most part. Now, why am I saying that? I think I made it clear through the 10, 12, or 14 different toxic metals I introduced in this conversation that their half-lives, or some of them are only hours, the most were 1 to 3 days in the general circulation. That's what I showed you. Unfortunately, if that's the case, what are you actually catching? Which burdens are you catching? Someone maybe had rice yesterday, you're catching some arsenic. Doesn't give you much as a clinician to go on to help them. And you'll miss those things that are of significant issue. And then again, what are you going to do? But if you take a chelating agent, and yes, I'm very concerned. I do understand. And I realize that this is an eclectic group that we're speaking to. Some of you have a license to write a chelating drug. Some don't. Don't worry. I'm going to give you the answer that I use. I have the ability to write, and I've done literally thousands of these. As a matter of fact, when it comes to chelation, other than being the grandfather of this, yes, now people call me the dinosaur. I was trained by the people that wrote the original textbook on toxic metals, and that most of them are gone now. I'm the dinosaur. Hopefully this dinosaur stays around a long time. But take my advice and realize that without a toxic test that's challenged, you will not get the right answer, which means that doing a spot urine, and when you call me, I have not much to tell you other than they probably were exposed a few hours ago or maybe a day ago. That's all you can say. So the way we're going to do this is teach you to use the heavy metal test. It's called 21 Toxic Urine 24-hour. This is Access Med Labs. It's in your panel that you have. I'm going to teach you to do this as an 8-hour challenge in just a moment. I'm going to teach you a chelating agent that every single person on this webinar can do. So get ready, and if you need to write it down, but this is the way you really want to know what's going on, by pulling these toxic metals out of the general circulation. Remember, after just a very few hours or days, these toxic metals, once you've been exposed, the human then puts them into their reservoirs, which become very toxic to that specific tissue and organ system. So let's get into this. I use something called an advanced zeolite. I actually go to the manufacturer, which, by the way, I tell you up front, I have no interest in. My interest is really to help those folks that are part of Rupa Health and as Access Medical Labs chief outside consultant. Going to do is basically try to help you to understand how this works. A zeolite is like a cage. It comes from volcanic ash that's been in the ocean for thousands of years. The person that does it, that has all the intellectual property, literally does two things. And only one type of zeolite I've ever seen ever works. And there are 4 zeolites. The only one that you can ever think of is clinoptilolite. Don't worry if you don't know the name. And what they do is they micronize it so small, because otherwise it just stays in the bowl. If you take any zeolite, won't work, just will go out the bowl. And because of its micronized, it goes into the general system. They do one other thing with this. They actually put it through a sift or a system to take out the toxic metals. You're saying, what do you mean, Mitch? Because when this sits in the ocean for thousands of years, itself, because of the way it's built, the lattice work of these zeolites, they actually pick up the toxic metals in the system. So it needs to be washed clean. And these are proprietary methods of doing it. This is the only one I use that I'm giving you. Again, no interest in the company, only to help you. That's all this matters. Zeolites are typically luminosilicates. And whether you know that or not, they are extremely safe. They don't have to be adjusted because someone has a kidney failure, which you have to do for the other, or kidney problems. This is safe. You can give the same thing to everybody. There's almost no side effects. Explain how to do this for a moment. And that is what I normally do. They're 10 milligram tablets. I tell someone, when you're ready to do your 8-hour procedure, I make it a 10-hour procedure. 2 hours before, I tell them to take, or I give them 4 capsules of my advanced zeolite capsules that they take. Once they take that, I tell them wait for 2 hours, about 15 minutes prior to the collection time, which they will time for 8 hours. Let them go to the bathroom and empty that out. After that, for the next 8 hours, they need to collect every bit of urine in the jug that will be provided on the 24-hour urine collection sample. And then, of course, they mix it, they swish it around at the end, pour off a aliquot a little bit. The kit has everything in there, put all the name and practitioner, etc. And that's what's sent to the lab. You are going to find so different results if you are been doing the singular, which really can never help you, in my opinion, unless it's acute like a few hours ago or a day ago. Genetic factors, liver and kidney function will impact the metal. Nutritional status can, and there is, as I said, no universal half-life for metals. But for the circulation, which you need to know, it's typically hours to a few days. That's it. You can also augment your testing that I just taught you with some lab tests, GGP, gamma glutamyl transpeptidase, which is a very good liver stressor that can tell for alcohol cirrhosis, cancer, and of course, many cancers as a metastatic marker, but it also goes up to toxic metals. Looking at the estimated glomerular filtration rate, the ALT, which is specifically a liver marker for hepatotoxicity. I measure in my office MDA, malondialdehyde, all the time because it tells me about that early lipid peroxidation we talked about earlier in this webinar. And if you want to go further, 8-hydroxydeguanosine does detect DNA oxidative damage. You don't have to go that far, but the others are important. Having homocysteine, we talked about already, and its importance when it's low, and having too much iron by results of having elevated ferritin, which are iron storages in the liver, in the kidneys, and of course, in the bone marrow. Ask questions, folks, of people, questions to identify potential risk. Are you living near an industrial area? What's your weekly consumption of fish? Do they have dental amalgams as a direct source of metal? Remember, the implants could be, as I told you, titanium. Dentists still, for some reason I can't imagine, use mercury. I would never let them put that in anyone's mouth. Again, they're still using porcelain too as bonding agents and things. And porcelain, of course, is a source of lead. So the more you expand your toxic metal exposure questionnaire, this is just a sample. You can use it and expand it at your leisure. The more you're going to say this person has the need for toxic metal testing. And of course, what's your intervention? Your intervention, of course, always put it in your note. You must, as a healthcare provider is avoidance. You tell them, go look if they have different ones. Often in our reports at Access, we'll tell you where a lot of these come from. But just doing a search, Google or Grok or one of the others, you'll get as many sources as you want. Many times the patient can't find it anyway because it could have been years ago and unknown how they actually got it in. But using filtered water, such as reverse osmosis, going with the low mercury fish, I suggested avoiding aluminum products, and that may help. And of course, don't drink tea with the lemon I told you about. Get a workplace that's safety and monitor the progress. Do follow-up tests. Treat that person. One of the treatments I do is I use the advanced zeolite. I use it all the time because it binds metals. Guess what else it does? Oh, yeah, it takes out VOCs, volatile organic compounds. It also takes out mycotoxins. It also removes some pesticides. It removes certain bacteria toxins as well. It is far more reliable, in my opinion. And at first, I can tell you, I thought it was ridiculous when first someone came to me, and then I stepped and I stopped because you can always learn something. Even the dinosaur here, I sat down with the person who was the biochemist that holds all the IP. I said, send me articles. I read close to 150 of them. I looked at this, and then I did the major thing. I started using it on patients, testing pre and post and everything. And the answer was quite obvious. They work. Phenomenal. At least this one did, because I've tried others. I didn't see any results. And this convinced me it does make a difference. Support liver and kidney health with your nutrients and things that you do. High fiber diets, antioxidants for detoxification. And if you're going to use IV chelation, of course, you have to choose the correct agent to match the thing that you're trying to remove. Chelating agents, there was about 200 of them, but only about 6 are non-toxic to the human. They require to be adjusted for kidney function. They also have what's called a pKa factor. pKa is an affinity factor. Like, for example, if someone likes to date blondes, it will go after that first. So, for example, EDTA may go get cadmium or lead first, and then may go down the line. Good news, zeolite formula doesn't work by that mechanism. It has no pKa value. It will cage all of them simultaneously. So this is good news for those of you that can't use intravenous forms of detox. This is what one of our lab results look like. And I think it's important to just take a look at this with me for 1 minute. These are the toxic metals. Now, there's a lot in this particular example that I brought, but what you should know, and I will repeat, A, there is no one test that tells the total toxic burden of any metal. When you look at this, we don't know how much is behind it. It's all by extrapolation of data. So if I see there, for example, a significant amount of cesium from my challenging agent, I have to figure that there's a lot more cesium where that came from. And even though there may be only a little bit of platinum that you see, which is extremely toxic, as we use platinum as part of the cytotoxic chemotherapies like cisplatin and carboplatin. So when we see that, remember, any little bit is a problem. Now, don't go and don't tell your patients, and actually tell them the correct thing. When you see the green, yellow, orange, and red zones, oh, look, the other ones are in the green zone. That's pretty good. No, it's not. First of all, the green, yellow, and orange and red zones were actually prepared to be able to give you information from a non-challenge test. And I just told you, don't do non-challenge tests anymore. I also already told you any little bit is a problem. I also told you that having more than one, like this case, which is obviously an exaggerated person that has an awful lot, this is geometrically added, and the damage that this person's getting is significant, regardless how good your program is. Gut program, oh, I gave them a great gut, but I gave them a terrific nutrition. I'm sorry. If they have this many meds, they'll fail and they will go elsewhere eventually. Here's my call to action. Toxic metals represent a significant health risk. Basically what I'm saying, if you have a patient who comes to you with a chronic disease, you need to do toxic metals as part of your initial protocol. I do, and you should. You need to test for exposure, and you need to figure out how much you want to give. Normally, what I do is I use the advanced zeolite formula. If they don't have a lot on my challenge test, I'll give them like 1 capsule twice a day. If they have a lot, I'll give them 2 advanced zeolite twice a day. And guess what? When I go back 3 months from now, assuming that they have done the avoidance looking and not getting exposed through work or whatever, their numbers go down precipitously. And that's what you want to know. The more you empower your patients with this knowledge and support, the better they're going to follow your instructions and the better result you're going to get. Whether you give them hormones, nutrients, diet, lifestyle modification, it will make a serious difference. And continue researching these toxic metals. Learn where they come from, or the major areas. It will help you in discussing it with your patient. Look, again, I told you, if you want to try the advanced zeolite, you want to learn about it, I will turn you over to the company. Just text me zeolite info to the number 772-4693. It's that simple. And I'll send it on to the company, or I'll send you actually that person's phone number. The person who runs this NutraPharma company that makes this happens to be in Boca Raton. This is an amazing company. They actually make all of my nutraceuticals that I make only for professionals. But this is a product that is that good, and I incorporate pretty much in every patient. Cancer patients as well. They all have toxic metals. Oh, yes, cardiac, all have toxic metals. Diabetes, they all have toxic metals. So if you want to know about this, you want to think about using this as a challenging agent, since you need to challenge, and you've taught that today, just text zeolite info 772-4693. This slide is my contact information. If there's anything else that I certainly can help with, and again, you can always contact your account manager or anyone that helps you at Access Labs. We're always here to help you with these type of things. I enjoy talking to many of you, and especially in consultation. I hope this was really helpful for you to be able to get a lot of information that you require.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.